Okay, let's talk about something that's super common, but can be really, really worrying: breast pain. You might hear doctors call it mastolgia, but whatever you call it, we're going to get some real clarity on what's going on.
If you've ever felt that ache or that tenderness or even a sharp pain in your breasts, I want you to know one thing right off the bat. You are so far from being alone in this. It is an incredibly common experience.
Just look at this number. A full 70% of women will have breast pain at some point. That means the vast majority of us go through this. So what you're feeling isn't strange or unusual. It's actually pretty normal.
But, when we feel pain anywhere, our minds can sometimes, they can jump to the worst possible conclusion. And with breast pain, there is one big fear that tends to pop up first. So let's just tackle that worry head on, right now.
This is the question, isn't it? It's the one that keeps you up at night and causes so much stress. Is this pain I'm feeling a sign of something really bad?
Let this number sink in. If you go to a doctor, they check you out, and they don't find any lumps or other warning signs, the chance that your breast pain is from cancer is less than 1%. That is an incredibly small risk.
And here's the bottom line, the thing that doctors really want you to know. Pain, all by itself, is just not a good indicator of breast cancer. It's almost never the main symptom.
Okay, so if it's almost never cancer, what in the world is causing it? Well, let's get into the real reasons, which, thankfully, are a lot less scary.
Most breast pain fits into two main buckets. The most common one is called cyclical pain. This is the kind that's tied to your monthly cycle. You know, that dull, heavy, aching feeling you might get in both breasts right before your period? Then you have non-cyclical pain. This type has nothing to do with your period and might show up as a sharper pain in just one specific spot.
Now, to really get this, we kind of have to change how we think about pain itself. See, pain doesn't always mean something is damaged. A lot of the time, it's just your body's alarm system going off.
The actual feeling of pain isn't really in your breast. It's a signal that nerves are sending up to your brain, and your breasts are just packed with these nerves. They're like tiny little motion sensors sending messages back to mission control all day long.
And sometimes that alarm system can just get a little jumpy. Think about a house alarm, right? It's supposed to warn you about a burglar, but sometimes a bird just bumps into the window and the whole thing goes off. That's kind of what's happening here. Things like hormone changes can make the nerves in your breast extra sensitive, so they're sounding the pain alarm even when there's no real danger. It's just a false alarm.
Just understanding that it's probably a sensitive alarm, not a sign of damage, is a huge, huge relief. So what can you actually do to help quiet that alarm down and start feeling better? Well, let's look at a few simple things that work really, really well.
The great news is that for most women, feeling better doesn't mean complicated treatments or medications. It all starts with 3 really straightforward, powerful steps: getting reassurance, making sure you have good support, and finding some direct relief. Seriously, this is the most powerful first step. A lot of the time, the anxiety over what the pain could be actually makes the pain feel worse. So just going to a doctor, having them check you out, and hearing them say everything is normal can make the pain go away. This one step works for about 70% of women.
Next up, support. I know it sounds almost too simple, but it makes a massive difference. Up to 80% of women feel better just by wearing a good supportive bra, like a well-fitting sports bra. It just helps reduce movement and gives the tissue support, which helps calm down those sensitive nerves.
And for some direct, targeted relief, an anti-inflammatory gel that you just rub on your skin is a fantastic choice. You put it right on the spot that hurts. For this kind of pain, these gels can actually work better than pills, they have fewer side effects, and they bring relief to 80 to 90% of women.
So let's put it all together. You get that reassurance from your doctor, you get a good supportive bra, and you use a pain relief gel. With those 3 simple things, about 90% of breast pain cases get better. That is an amazing success rate for such easy steps.
All right, as we start to wrap up, let's just quickly go over the most important things to remember from all of this. What do you really need to take away? First, just remember, this is super common. You're not alone. Second, and this is the big one, the risk of cancer from pain by itself is extremely low. Third, try to think of the pain as a sensitive alarm system, not a sign that something is broken. And last, remember that simple things, reassurance, a good bra, and a pain relief gel work wonders for most women. And I really want to leave you with this. The pain you're feeling is absolutely real. It's not in your head. But the fear that so often comes with it, that doesn't have to be your reality. Knowing what's really going on gives you the power to get reassured and find relief.